so that we can share it with others. And we'll send it out also to the Clergy and Leadership Council. So Jessica, okay, you are recording. Okay, Rosemary, sorry.
Okay. Loving and healing God, we ask you to help us be aware of your presence and to guide our thoughts and our spirits in your way to bring health and healing and wholeness to Fairfax County, to this community. Help us to speak your wisdom and to hear each other. We offer this in all our prayers in your name. Amen.
Amen. Thank you. And again, welcome to everyone. This is as we have been doing during the time of COVID, having briefing and updates from the health department staff regarding different changes, protocols, and policies. And we wanted to make sure that we came together to discuss around hosting vaccines, vaccinators, and what to look for. And again, we have our friend Sharon Arndt from the health department here with us to help guide us through this time, to provide information and to answer any questions that you may have. So if this was a show, I would say Sharon is no friend to the show. She's a friend of the show. So Sharon, please, thank you again for coming and being with us and sharing with us this new information that you have.
Thank you, Ramona, and thank you everyone for attending this afternoon. I'm pleased today to be with you all, and as you know, we've been meeting together to help navigate this pandemic for many months now. It's actually 14 months, but we do see hopeful days ahead with everyone's continued engagement and support. I have with me today my colleague, Taylor Fletcher. Taylor is with the Health Department's Emergency Preparedness and Response Office, and she is my go-to person for understanding a facility that we might be looking at to place a vaccine equity clinic. So in the health department, we are partnering with many different partners and providers and locations to offer vaccine, but we are also working on a vaccine equity strategy, which Taylor and I work hand in hand on that strategy, and that's what we want to share with you today. But before I really explore vaccine, I thought it would be helpful to give you an update on the disease, of the status of the disease in the community today, since this is an opportunity to meet with you all and share this information. Right now, well, in the last few, as you know, we had a peak in December and January, and those were very sad and very stressful times for so many in our community. But right now we are at about an average of 180 cases a day. A few weeks ago, we had plateaued in March. We are starting to plateau, but we are seeing that cases are ticking up a bit. They are actually moving in the wrong direction. Yesterday, we had 235 cases in the day with our average of 180. And as you might recall, a few weeks ago, we were about 150 cases a day. So we are ticking up a bit, and when you do the math, that's, a little over 1,000 cases a day, 1,000 cases a week in our community. So we still must be very mindful of this pandemic and still continue to promote protective behaviors and what is needed. And I know it is such a challenge at this time of year with all of the faith holidays, start of Ramadan yesterday. We all want to gather together with our flock and with those who we share a common faith with. And it is very difficult, but we must continue to be careful because we are seeing disease tick up. We are seeing disease most prevalent in the ages of 20 to 34 years, and also in youth of 10 to 19 years old. So in the age group of 10 to 19 and 20 to 34 years, that is where we are seeing the highest rates of disease right now. So all of you with youth ministries or some connection to the young adults in the community, it's definitely a time to reach out and continue to remind them of the protective behaviors that they should be adopting and continuing to maintain at this time. We think that the reason for the uptick in those ages is because of new variants. We haven't had a lot, but we know they are in the community, but also mitigation fatigue. So many are tired of the restrictions, particularly our young adults, and those adults who haven't had the benefit of the freedom that comes from being fully vaccinated. In Fairfax, actually, I think, Taylor, if you could show the slide presentation at this time, I have just a couple of visual prompts for everyone. So we're gonna try this.
Yes, one moment. Let me pull it up. All right. Can you see my screen?
Perfect. And you can just do slideshow. Great. I just jumped in. As Ramona shared with you all, we did come up with a title for our presentation today. So we're going to explore vaccine, but I want to give you that disease update first. And now, Taylor, the next slide, please. Oh, well, actually, let's back up, Taylor. Sorry, guys, there's so much going on. We came up with an agenda, which we hope to share with you about vaccine status, which I'm going to do momentarily, our place-based strategy, the topic of vaccinators, the COVID-19 vaccination process, which Taylor will walk you through what a COVID-19 vaccine clinic consists of, the different steps, which to include the specifications for how you can set up a clinic to support those steps, a checklist, which is some work that we do and technical assistance we provide when we're doing health department clinics, but we really think it's of value for you to have this awareness if you are considering hosting a clinic. A case study of a house of worship that we have assessed and what Taylor looked for. And then at the end, we'll have questions. Okay. So let's get back to, on the next slide, let's get back to the vaccine. Many of you may be familiar with the dashboard that the health department has been supporting for many weeks now. And we are currently in the midst of phase 1C. We're in phase 1A, which was healthcare providers and long-term care residents. Phase 1B, which were adults over the age of 65 and adults with 16 to 64 with underlying health conditions, as well as our frontline essential workers. And those frontline essential workers, as I last shared with you, those included folks who are providing face-to-face support in the different food pantries and food banks. And at the end of 1B, we had clergy included there as well. And now we are in phase 1C, which are other essential workers. So our grocery and grocery we're in 1B, but our restaurant, our construction, our technology and finance and other essential worker categories, they can register today and into the future. And then soon on Sunday, we will be in phase 2. We will be open along with the rest of the state in phase 1-2, and I'll explain that a little bit. But what you can see here is on our dashboard, we have administered so far in Fairfax County, 623,000 doses have been administered. And, you know, to put that in context, we have 1.2 million residents, probably just under 1 million adult residents who come Sunday will have the opportunity, everyone will have the opportunity, those adult residents will have the opportunity to register for vaccine. So we do have in Fairfax, in our community, because of our numbers, we have quite a task ahead of us, and we are moving through it. And as I said, 623,000 doses have been administered. So the magnitude of the work at hand is quite large, and you see on this dashboard that we are committed to the work and actively distributing doses as quickly as we can. So over 400,000 residents have received at least one dose, which is about 45% of our adult population. We have 20% of our adult population who's fully vaccinated, and that's about 233,000 individuals. We have noted in our awareness of vaccine that we do have some disparities in vaccine uptake by geography, race, and ethnicity, and I will address that on the next slide. So this is an image from the vaccine immunization system, and we do look at this data in the health department to make sure we are targeting vaccine, at least for our vaccine equity strategy, we are targeting vaccine in a place-based sense where there is lowest uptake. When you look at this picture, the zip codes of, or the darker colors, and on the western side of the county, you can kind of just see a faint discoloration between like Herndon and Centerville. You can see it's a little bit darker there, but when you really look at the orange and the burgundy colors, the Bailey's Crossroads, Colmore, Lincolnia, Richmond Highway Corridor, there's a lot of work to be done to bring those adults in that community up to the average of the rest of the county. So our vaccine equity clinics that we have been partnering with some houses of worship on, as well as using community centers, whatever, are really focused in these areas where we have the greatest need from a public health perspective to increase vaccination rates. So when we look, you can see the disparity in geography, but we also know we have a disparity in race and ethnicity, where we have more to do, and we need to connect more of our African American and other persons of color to vaccine. So there is work to be done, particularly in our African American community who is underrepresented, and in these geographic areas, and for all the residents who live in those geographic areas. Next slide. So when we talk about delivering vaccine, the first thing, aside from the vaccine supply and the dose itself, we need a vaccinator. We need someone who is qualified to administer vaccine. And in our community right now, the health department has been mobilizing its nursing staff, whether they are clinic staff or public health nurses that work in the schools, mobilizing and partnerships with, we brought on some contract staff and our Medical Reserve Corps volunteers, those who are doctors and nurses qualified as vaccinators. We're really mobilizing quite an effort. We had a vaccination clinic last Saturday at the government center. We administered 6,498 doses. I think that was the planned number. And we had over 100 vaccinators there, or about 100 vaccinators there to support the effort. So anyhow, you need vaccinators. The health department, hospital, we've been working with Inova, we've been working with Kaiser. We're working with independent pharmacies that are coming online very quickly with federal government doses with the Federal Pharmacy Partnership. They're out there in the community. Some of these independent pharmacies may have contacted you in houses of worship to stand up clinics, and we'll explore that a little. And then also community physicians, private providers, we're seeking to bring them on board. And really our goal is when on Sunday, April 18th, when someone goes to vaccinefinder.org, they will recognize that the health department is a vaccine provider, not the vaccine provider. So early on in January, February, early March, really the health department was kind of the only game in town. But we are quickly moving and have been standing up the capacity across our community so that we are a vaccine provider, one of many. And your house of worship might serve as an option for one of these many opportunities for our community to receive vaccine. So that's what we want to explore today with you all, is if you are considering this, what it takes to operate and stand up a clinic in your house of worship, and what technical assistance the health department can and cannot provide. So I think that is the last slide I have, and Taylor is going to walk you through the what she looks for as a emergency management planning professional in setting up a vaccine clinic, or what the components are for a clinic. So Taylor Fletcher, I'm going to pass it along to you.
Thank you, Sharon. Good afternoon, everyone, and thank you for having me here today and for tuning in on this conversation on recommendations and best practices for being a host site for a vaccination clinic in Fairfax County. As Sharon said, my name is Taylor Fletcher, and I'm an emergency management specialist with the Office of Emergency Preparedness and Response at the Fairfax County Health Department. I'm currently serving as the Deputy Vaccine Branch Director for Community Vaccination on the COVID-19 emergency response. First, today I'm going to walk you through the COVID-19 vaccination process as it's set out right here in front of us to set the stage for our conversation. And then I'm going to review the guidance document that was created to assist houses of worship, community centers, and the like with community vaccine clinic planning. And then we're going to discuss how much space and what facility features are needed for a 100, 250, 500, and then 1,000 dose vaccine clinic. And then we're going to review a vaccine site visit checklist that I use for every site visit, and then apply what we've learned and look at photos from my notes and an actual site visit that I conducted that is currently being used as a vaccination site. So this is the typical process of a COVID-19 vaccine clinic right here on your screen. So first, clients make their appointments either through targeted community outreach, in which a trusted member of the community is helping each client register for their appointment, or through the distribution of a registration link. However, for all community vaccine clinics, it is imperative that you use the targeted community outreach approach so that you can control the flow of traffic and clients to your facility at any given time. And it's important that only those who have appointments are who you are letting inside for the day, just to cut down on any egress, ingress issues, and to make sure that all those who are registered receive their dose. Next, clients arrive to the clinic at their designated appointment time, find a parking spot, and make their way to the entrance of the clinic. Immediately upon entering the clinic, a client is typically greeted by a staff or volunteer, which I will refer to as greeters in this presentation. The greeters verify that the client is indeed on the schedule, that their appointment time is correct, and that they have arrived at the designated appointment time. They can also, depending on how registration is completed, collect any outstanding information from the individual at that time. After greeters finish checking clients into the clinic, this is also the starting point where a line queue can form if you have the available space in your building to queue up clients before they move to the vaccination area. So from the greeting area, the client is then directed to the vaccination area by flow controllers, where the client will be directed to a vaccinator station, receive education on the vaccine from the vaccinator. They can ask any questions of their vaccinator and then receive their shot. From there, the client moves to the post-vaccination area, also known as the adverse event waiting area, where they wait for 15 to 30 minutes after their vaccination. This waiting period is important because if the individual is going to have an adverse reaction to the vaccine, it is most likely going to be in that 15 to 30 minute time period. And the timing that a client should wait here is dependent on their medical history, and how long they should wait, either 15 or 30 minutes, is determined by the vaccinator. Now, the post-vaccination area can be in the same room as the vaccination area if the space in your facility is large enough to accommodate both, but it can also be in an adjacent room. And it's recommended that a nurse oversees this area so that they can administer any life-saving measures, but it is not required that you have that a nurse oversees it, as long as you have nurses nearby who are ready to assist immediately. And of course, if a true adverse reaction event does occur, it will require EMS transport. Once the client waits for their 15 or 30-minute waiting period, then they are free to exit the clinic and go about their day as they would. So here's a visual of the process that I just described. You're going to see each step of the process is covered by this visual aid. So here you see this is the parking lot. This is the external of the building. And then you go to the entrance where clients are greeted and checked into the clinic. If there's a line queue space available, the clients would then queue in line, enter through where they're directed to the vaccinator stations right here on the right-hand side of your screen. And then once they are finished there, they go to the post-vaccination waiting area, and then they exit the clinic. So there are many options for setting up your facility as a vaccination site. However, this is just one layout that can be used if the area is a large open room, such as a gym or a fellowship hall or other multi-purpose room. Okay, so these are our planning assumptions that we're going to be working off of today in our discussion. So each of these are throughput estimates, meaning it's an estimate of how many people will be coming through your facility for a vaccine on any given day. The planning assumption for each of these scenarios is that your operation will last about 8 hours. So that's 6 hours of vaccinating and 1 hour on each end for setup and breakdown. Keep in mind that within these 8 hours, you should also account for a 30-minute lunch break for staff over the duration of 1 hour. So meaning half of the staff would break for 30 minutes and then the other half would break for 30 minutes. So the first estimate is for a 100 to 150 dose clinic, which breaks down to about 23 doses per hour or 6 clients scheduled every 15 minutes. The second estimate is for a 250 to 300 dose clinic, which breaks down to about 45 doses per hour or 11 clients scheduled every 15 minutes. The third estimate is for a 500 to 600 dose clinic, which breaks down to about 90 doses per hour or 23 clients scheduled every 15 minutes. And the last is a 1,000 to 1,100 dose clinic, which breaks down to about 180 doses per hour or 45 clients scheduled every 15 minutes, depending on how you want to look at it. So for space and site recommendations, I have done the math for each of the 4 planning assumptions. And there's 2 notes I wanted to make. So first, all square footage recommendations are made with social distancing between each table and chair and adequate room for egress and ingress in mind. So you might see some of these numbers and think, oh, wow, that's a lot of space. Well, you know, with this pandemic, we do have to account for social distancing. So that's taken into account in all of these measurements. And also, please note that it is preferable if the post-vaccination area can hold the number of chairs equal to the per hour client ratio. However, I do realize that this may not be feasible with the available space you might have to work with. So with that being said, the number of chairs in the post-vaccination area that you see on the slides above is the maximum number of chairs that you would need to have in that area, not the minimum. So that's kind of what we're going for. It might not always be what we can get. So for 100 to 150 doses a day, you would want to make sure you have parking for 40 people. So that's accounting for the staff that are coming in every 15 minutes, as well as the staff that are working or the volunteers that are working your event. You would want to attempt to have a space for 7 clients to queue indoors, socially distanced. And that indoor piece is important, and we'll talk about it later. If when we get into the summer months and there's extreme heat or any inclement weather such as thunderstorms, lightning, things of that nature. So the greeting area, you would definitely need a power source and 2 greeter tables and 2 chairs. And so that power source can be along a wall in the lobby, or you can run an extension cord across the ground, as long as that extension cord is taped down to the floor to prevent trip hazards. We'll talk more about that later as well. Your vaccination area for a 100 to 150 doses per day clinic would need to be at least 400 square feet with 5 outlets and 5 vaccinator tables and 10 chairs. All of that needs to be socially distant. And then for the post-vaccination area, you would need at least 550 to 800 square feet with 23 chairs max for the post-vaccination area, socially distanced. So that means that these chairs are spaced 6 feet apart in that post-vaccination area. For a 250 to 300 dose per day clinic, you would need parking for 80 people, space for 13 people to queue up, socially distanced. The greeting area, you would need 4 outlets, 4 greeter tables, and 4 chairs for those greeters. And your vaccination area would need to have 650 to 800 square feet, 10 outlets for each of the 10 vaccinator tables, because assuming that those vaccinators will be using technology to do data entry of the vaccination itself, with 20 chairs, 1 for the client and 1 for the vaccinator. So 10 chairs for the vaccinators and 1 for each client. And then that would also need to be socially distant. And the post-vaccination area, it would want to be 1,100 to 1,500 square feet with 45 chairs maximum for post-vaccination, all socially distanced. Remember, these are recommendations done with math in mind with our facilities unit here at the health department. So a lot of thinking, a lot of planning has gone into these recommendations.
Yeah, but any realistic thinking?
I mean, these are realistic. Depending on your space, you would just need to have a lower dose per day clinic, and that's just the reality of it. It's unrealistic for most spaces that I've seen in the county to do a 1,000 to 1,100 dose per day clinic. That to me is a little unrealistic. But if you have the space available, it's certainly not unrealistic. So we'll talk about now the 500 to 600 dose per day clinic. So that would need parking for 160 people with space for 26 people to queue, socially distanced. Your greeting area would ideally have 8 outlets, or at least 8 places with an extension cord to plug in 8 different devices where people would check in and the greeter would do data entry. If you don't need computers for your greeting operation, meaning someone is just checking names off of a list essentially and there's no data entry needed, then of course those outlets aren't needed. But if you're doing any data entry at the greeter area, or if you're making copies of any IDs or insurance cards or anything of that nature, you would want to make sure you have places to plug in those electronic devices. Your vaccination area would be 1,600 square feet with space for 20 vaccinators and 40 chairs for the tables. So of course you would have 1 for the vaccinator and 1 for the client. And the post-vaccination area would need to be anywhere from 2,200 to 2,500 square feet with maximum number of 70 chairs. And remember that's just the maximum. You can do less than that depending on your hourly rate. And then the 4th planning assumption is for the 1,000 to 1,100 dose per day clinic. So that would need ideally parking for 320 people, space for at least 52 people to queue, socially distant, a greeting area with outlets and tables. If you used assets, obviously you need more outlets than if you do not use any information technology assets. The vaccination area would have to be at least 3,000 square feet with 80 chairs total, 1 for every vaccinator and 1 for every client. And then your post-vaccination area would be 4,500 to 5,000 square feet. I know that number sounds jaw-dropping, sounds a little bit alarming, but that does account for a socially distanced operation, and of course, the 140 chairs is representative of the doses that you have per hour. That is not necessarily the number of chairs you need, it is just a recommended number of chairs. So just reiterating that one more time for the group. So moving on from the facility recommendations and space recommendations to staffing recommendations. So you'll see the numbers before you for each of the 4 scenarios. And I'm not going to focus as much on the numbers as I am on what the positions do. So you can decide, make a decision on, what positions are necessary for your operation. So it is preferred that the pod manager, which is the manager of the entire clinic, is a physician or a registered nurse with leadership and vaccination experience. The deputy pod manager can be, it can be a non-medical personnel, someone that does not have a medical background, but leadership experience is also preferred for this position. The vaccination team lead reports directly to the pod manager and should be very familiar with all of the CDC COVID-19 vaccine guidance and standing orders. The vaccinators report up to the vaccination team lead, and those are the people that are actually going to be giving the shots. Those should be doctors, registered nurses, licensed practical nurses, or pharmacists, or anyone that is deemed qualified to give a vaccination for the COVID-19 vaccine. It is recommended next that the post-vaccination staff are nurses, but if staffing is limited, then it is not required that that person is a nurse, and the post-vaccination staff reports to the pod manager. Next, you have your greeters. So greeters report to the deputy pod manager, typically in the health department's response. Those must be able to perform data collection, appointment confirmation, and registration. Again, the full responsibilities of that position just really depend on how you're doing your registration and what information is being collected ahead of time. And it depends on how much information they need to collect on site, depending on how much you're collecting ahead of time. The flow control unit leader reports to the deputy pod manager typically, and that position assures that physical distancing throughout the clinic is being conducted and ensures that the pace of service is efficient and that everything keeps moving. So you'll see that depending on the size of the clinic, there's an additional position that's added. So for the 500 and 1,000 dose model, a flow control team leader is added, and that is just because there are so many flow controllers that you kind of need to add that middle person to manage it all. So like I said, depending on the size of the clinic, the team leader position can also be staffed as a mid-level position between the flow control unit leader and the flow controllers, and that position will provide guidance and oversight to the 3 functional areas of flow control. And the 3 functional areas of flow control you'll typically find out in the parking lot, making sure you're directing the incoming residents or clients to available parking, assisting them if they need, wheelchair assistance or any assistance with mobility, and preventing trip hazards if there's an uneven spot in the parking lot, putting a cone there, standing near it, making sure people are watching their steps, stuff of that nature. And then you have the functional area in the line queue where you're ensuring that people are maintaining a social distance and that the line is moving at a steady pace. And then in the vaccination area where the flow controller is essentially pointing people to the available vaccinator tables. And that position is more important the more vaccinators that you have in a space, because it's hard to see all the vaccinators. But if you have a smaller clinic, then you don't need as many flow controllers in the vaccine area itself, because if you can see everything, then that's not really needed, and you can have your little flags or something that the vaccinators can wave that show that they're ready for the next client. So flow controllers, as I already touched on a little bit, report typically to either the unit leader or team leader, depending on the size of the clinic, and they just make sure that things are running efficiently and effectively and safely as far as line queuing and just general flow of clients throughout your clinic. Okay, so now I'm just going to go into some general facility considerations, things that I'm looking for in my site visits typically. So starting at the top, we want to make sure that there are some ADA accessible parking spaces out front. There's not really a minimum number, just to know that, you know, there are some available, and you can maybe block off some other spaces if you have a lot of clients coming in with mobility needs, so that they are not parking as far away and they can be close to the entrance and exit. You also want to check and see if the entrances and exits that you've chosen for your clinic are ADA accessible as well. So can I bring a wheelchair through this entrance and exit? If not, it's probably not the best place to bring clients in the building. So you might want to choose another. And the restrooms as well. So depending on the population that you're serving, the restrooms that you choose for public restrooms should be, and it's recommended that they are also ADA accessible. I look for sidewalks at entry and exit points because I can't send clients out of a rear entry of the clinic that goes straight into a grassy area or straight into a parking lot without a sidewalk, because it's a safety concern. So I'm making sure that wherever my exit is, that there's a sidewalk there, and that wherever my entrance is, that there's a sidewalk there as well, with accessibility in case I have somebody going out or in an entrance or out an exit that has a mobility need. I also look for, when I go inside the front, wherever that entrance is, that there's space for greeters and space to queue a line, in case people show up early, or if there's extreme temperatures outside and you can't queue people outside, or inclement weather or the like. So I'm looking for somewhere I can put a booth, a table, some chairs, and maybe a small space I can queue a line. If there's not a line queue, it's not the end of the world, but it's good. It's good for when there's inclement weather and you can't have people standing outside in a line. I also look for outlets, as we discussed earlier. If I do have IT assets at the clinic on the day of, I just want to make sure that I can charge them up. That's very important, especially for vaccinator data entry. Separate exits and entrances for client flow is preferred, but it's not necessary. And we'll talk about that a little bit later in our case study. I'm looking for also a place that we can store extra supplies if we need to, out of the public eye or out of the public flow. So, you know, that's medical supplies or any other supplies you need for the day. It's important that no other activities are going on in the vaccination and post-vaccination area while the clinic is running. I know sometimes certain days of the week there may be preschool classes or Sunday school class, or not Sunday school classes, but different classes going on. But it's important that the only thing going on in that area of the building is the clinic on the day of. I check for restrooms for staff, and I check for separate restrooms for clients. If there are no separate restrooms, again, it's not the end of the world, but it's good to have a restroom for staff that they can quickly get in and get out, so that they can get back to vaccinating, or they can get back to, you know, controlling flow or greeting. I also look for an employee rest area or break room, because, you know, with 8-hour shifts, people can get tired standing on their feet all day, and it's good to have a place for, you know, your volunteers and your staff to just go sit, take a sip of water, or have a snack. I'm also making sure I have a medium to large space for vaccination, a large open room for post-vaccination, and that I have access at the facility to tables and chairs. And that's important, because if the facility has tables and chairs, that's perfect. It's less supplies that, you know, partners have to bring in. But if they don't, that's also good to know, because we cannot have the clinic without tables and chairs. So we'll need to arrange to have those brought in. All right, and as I mentioned earlier, the vaccination area should also allow for social distancing, or all areas of the pod really should allow for social distancing, ingress and egress. And if you're using any extension cords or anything laying across the floor, that you're just taping it down or being mindful not to send people across that, because you don't want to create a trip hazard. All right. So other considerations that should be thought of when you're planning a clinic, one of them is signage. So depending on the location of your facility or the location of the clinic within your facility, it might be helpful to have some signage created. And so these are just two examples of some signage that might be beneficial, especially if you are not able to get as many flow controllers to direct clients. Signage is a good thing to use in its place, although it's not recommended, because as we know, signs can be on the wall, but people may still be confused about where to go. So it's always good to have flow controllers, both and signage, but if you can't have flow controllers, at least you can have some signage. Cleaning and janitorial services. So I've been in some facilities that don't normally do cleaning and janitorial services every day of the week. But if you're running a clinic, you want to think about that. Who's coming to pick up the trash? How is the pharmacy or whoever is coming in to do the vaccinations taking care of their medical waste? In the bathroom. So if you don't have an ADA accessible bathroom, you might want to send or have a cleaning service come in and do extra cleanings of the restroom more periodically throughout the day, especially with the 65 and up population. That is something that we've had to do. When you are scheduling your clinic, you want to be sure you're communicating the dates and times of your clinic with the local authorities in case something happens and you need to call them. They know what you're doing, where you're doing it, and they know which door to come to respond. So that's always important to reach out to your local police station. Also, refreshments for volunteers. Again, that's recommended, it's not required. Your volunteers will be a lot happier if they have, some water or something to snack on throughout the day. If it's a long day, lunch is also a good thing to do, or coffee in the morning. We get that feedback a lot at the health department, so that is something I wanted to mention to you. And then inclement weather, we touched on it briefly. But if you have staff or volunteers stationed outside helping with flow control, you want to just be monitoring the weather for the day. We're approaching the summer months. It's going to start getting very hot outside, and there's going to be thunderstorms accompanying that. So you want to make sure you're paying attention to the local weather report, and you have resources on hand for staff working outside, like water, sunscreen, ponchos, and that if it is thundering and lightning, that you're bringing them inside. You're also not queuing clients outside during inclement weather. Okay, so this is what my vaccine site checklist looks like. So when I go to a vaccination site, I take this worksheet with me. It keeps me on task at my site visits, and it helps me remember everything I need to look for. And all of the notes that I take on this checklist inform my planning and my follow-up with, the necessary community partners that I'm working with, or the pharmacy or other providers. So next, I wanted to share some examples from the field. So these photos were taken at a facility that is currently being used as a vaccination site by a local pharmacy. And I chose this facility as a model because it's been a successful clinic so far, and it runs pretty smoothly for the pharmacy that sponsors it. And at this facility, you'll see here that the front entrance is also the exit of the clinic. However, you'll also see that there's plenty of space for clients to pass in and out of the building without running into each other or impeding the throughput of the clinic or impeding flow. And you'll see that the door on the far left in the first picture with the entrance and greeting area is an ADA accessible door for clients with mobility needs. That's always a plus. There's also a security desk at the front that doubles as a greeter station for incoming clients to check in and fill out any lingering registration paperwork that they might have. And you can't see them in this photo, but there are outlets right behind that desk for equipment to be plugged in should you need to use laptops, printers, scanners, or anything of that nature. Also, there's a long hallway. It's very wide that clients can queue up along the right, 6 feet apart, and also leave the vaccination area with enough room for people to pass on the left. So this hallway is really good. Unfortunately, like I said, the exit that I was planning on using at this facility was led right into a set of stairs, which, as we talked about in this discussion, is not the best for those with mobility issues. And so they've used it for some of the clients, but most of the clients will just exit and enter through the same door. It's not recommended to use separate exits for clients, but in some cases, some people do make that call. Personally, at the health department, we do not. But like I said, these are just recommendations, and I just wanted to share them with you. Okay, so the next photo is a large banquet hall. So this is actually where the facility did their vaccination and post-vaccination. This is just one side, one angle of the hall. Unfortunately, I did not have a photo of it being set up, but you can see that the facility has tables and chairs. The chairs are back here, kind of in the far top of the screen, and then you have all these tables. So those can be rearranged to accommodate the vaccination area set up on one side of the room, as well as the post-vaccination setup on the other. And then finally, there was a large parking lot outside with many ADA accessible parking spaces and sidewalk space that is accessible for those with mobility needs. So that was also a good feature of this space. These were my notes. So when I am taking my notes, as we kind of saw earlier, I like to record how many parking spaces are there because it helps with planning your throughput number. Obviously, you don't want to have less parking spaces than you have clients coming in per 15 minutes, per 30 minutes, or per hour. So you want to keep that in mind. You can also, there are also a lot of different ways to hold a clinic within the same building. So there's some facilities, you can do post-vaccination in 2 different areas, or you can do vaccination in a couple different areas. So it helps to just write the notes down and kind of visualize each scenario and then come up with the best one, the best combination of spaces that makes most sense and is the best, has the best customer service outcome for the population that you're serving. Something I also want to note here is room capacity. So a lot of times in these big banquet halls, the room capacity is going to be posted, but you have to remember that's a pre-COVID number. So while, yes, before COVID, you could fit 322 people in this room, we know it is not going to be that number anymore. So please be thinking of that when you are recording that information. Also, something I didn't know earlier, but I wanted to share is to pick out the door that the EMS needs to come to if you have to call them. So, most times EMS will just come to the main entrance of the church or to the building that you're in, but that might not be the best entrance to access the person that needs the medical help. So just be familiar with the doors of the facility and where to tell EMS to go to help the person that's in medical distress. Okay. And these are just some other notes that I took about accessibility. This facility had 2 wheelchairs of its own, which is good because it's a good starting point, and we know that we can build on that number with the resources of the community. What else here? Anything to note? Oh, so I did recommend that you saw how large this space was and you saw how wide the hallways were and how big the lobby was, but I still recommended that they could start anywhere from 60 to 200 doses and could increase depending on how the results from that first initial clinic. I always like to quote less because if it goes smoothly, then that's perfect. The goal is good customer service. So I always stray off from biting off more than you can chew, because you want the population you're serving to have a positive experience, and you want to give good customer service to your population. It's quality is better than quantity if you don't have the space to really pull off something that you may be wanting to. So keep that in mind as well. Okay, I know I talked a lot and there was a lot of information given earlier, so we'll just open it up to questions, comments, and then either myself or Sharon or Ramona can answer those.
Taylor, could you stop sharing your screen? Great. Thank you. Thank you, Taylor, very much for the comprehensive review. Ramona, we do have questions in the chat. Do you want us to work through the questions in the chat, or do you want to call?
I was going to say, do you want me to read them, and would that work?
Sure. Yep.
Let's see. People were asking about the PowerPoint. I know we're recording this, but will people be able to have the PowerPoint presentation?
Yes, absolutely.
So there's a question about mobile vans, and if we've looked at mobile vans to handle shut-ins and the homeless as well.
Yeah, so I'll be happy to answer that. So our health department response, our public health response has been multifaceted. So for shut-ins, and which we are referring to, as you're saying here, shut-ins, we're referring to those as our homebound residents. And we do have a homebound vaccination program where once someone is eligible for vaccine, and they have been eligible since January 11th, if they are assessed and considered to be truly homebound, that they cannot leave the home rather than they do not desire to leave the home. So if they are assessed as being homebound, they are placed on a list, and we are working in partnership with Fire and Rescue, and we provide Fire and Rescue EMTs a sort of a route, and they do that a couple times a week, and we deliver vaccine in residence to residents who are considered homebound. So that is sort of the homebound vaccine program. And for the homeless, we have been working early on. Actually, Virginia included when we entered 1B, and it included public safety, homeless, and corrections. Virginia actually took the step to include homeless residents along with the homeless provider essential workers. So that was great news to be able to provide that support to our homeless residents. And we have been working, the health department has had for many, many years, homeless nurse practitioners. We have a program of nurse practitioners who provide support to our homeless residents, and they have taken on the work in coordination with case managers at the different homeless shelters and different homeless locations. They've taken on the work to vaccinate our homeless residents. So we are actively vaccinating our homeless residents. They just closed out the vaccination efforts because the hypothermia shelters have closed down. They were doing vaccination there, and they're doing it in the different shelters and all the different type of homeless facilities that our nonprofits and our county operates.
Okay, thank you. And then I see, so I'm going to combine these questions. I think I can do that. So there's some question about, I guess, the support. So whether we're looking at Medical Reserve Corps or to fill out with some of the volunteer options, as well as have you looked into, I guess, military personnel, have they ever been considered for volunteer options? And then I guess parking, if parking is not readily accessible at the facility, are they able to use other parking spaces for their clinic if they choose to host one or are able to host one?
So I'll take on the volunteer question, and Taylor can address the parking space question. So for the health department response, we have had for many years, actually since 9/11, we have had a medical reserve corps. And for those of you who are not familiar with the medical reserve corps, that is the volunteer arm of public health. That is the cadre of residents who support public health volunteerism. And they may be medical, like Taylor mentioned, they might be doctors or pharmacists or nurses, but they also may be non-medical. We use quite a few non-medical. Our non-medical volunteers right now, when we are doing a vaccine equity clinic in a community center or house of worship, I have about 6 to 8 non-medical Reserve Corps volunteers support that effort, which has just been a blessing. And they are so great because they're already trained up. Of course, we work them through and certify them with background checks and HIPAA compliance, and we do health department training, and they know their job roles, as whether Taylor talked about queue and greeting and parking, and our Medical Reserve Corps volunteers are familiar with their roles to support a vaccine clinic. So they're a wonderful resource for us, and they have been supporting our countywide vaccination efforts, the queue, the pre-registration efforts, but they've also been supporting our vaccine equity clinic work, where we are working in different houses of worship or community centers. And then as far as the nearby military facilities, we have, to my knowledge, we have not tapped into them yet for support. We've been very fortunate with our Medical Reserve Corps to meet our volunteer needs. There is a call right now by Volunteer Fairfax looking for additional volunteers to support the INOVA effort, and perhaps that can be connected to the military facilities, but we have not reached out to them at this time. And then Taylor, I'll turn it over to you for parking.
Thanks, Sharon. So for the parking question, there's 2 possible recommendations. So the first is, so these targeted clinics are most likely going to be pulled from the neighborhood surrounding your facility or your house of worship. So if your facility is operated in the clinic is operating in a walkable community, I recommend communicating certain parking limitations to the clients that you're signing up and encouraging walking if possible. If it's not possible, or if there's a weather issue, it might be beneficial to reach out to any local businesses that are nearby and starting a conversation about possibly utilizing some of their space as parking. I know the health department has done that in the past with tenants that are located around our building, and we've built some relationships that have been beneficial in letting us use some of their parking spaces. I know that's, short of creating a whole new parking lot at your facility, I know there's some limitations with that, obviously, but these are some good options that we've used in the past.
Thank you, Taylor and Sharon, for answering those 2 questions. And Sharon, before we answer the next question, if you could just give some clarity around why we're providing this guidance, that this is for the possibility of clinics, but also if houses of worship are approached independently, because some of the other questions are specific to how often should they host a clinic, and I just want to make sure that we have that clear before we go a little further.
Right. Thank you, Ramona. So in our response and in this work, we do have the need and the desire to place community, what we're calling vaccine equity clinics. And earlier I showed you a map where we're really trying to target areas that need additional vaccine opportunities for our vulnerable residents, and where we can strengthen our vaccine access for our African-American residents, as we're trying to increase the levels of vaccination in our African-American community. So there's that, and that's really targeted equity work of the health department. But also in this work, we have come to be made aware of independent pharmacies reaching out to houses of worship, desiring to stand up a vaccine clinic. And, you know, we don't want to slow down or reduce opportunities for vaccination, but we also want you all to be fully informed if you are approached by an independent pharmacy, because now independent pharmacies are getting vaccine doses from the federal government. So if you're approached by an independent pharmacy to host a clinic, then you have an understanding of what it takes to host a successful clinic. We are not asking you all on this call today to host a clinic or to sign up for a clinic, but we want you to be informed if that is something you are considering or you've been approached, what it could take and what you need to consider for a clinic. And if I could, Ramona, give a couple examples. It's come to my attention that an independent pharmacist hosted a clinic at a house of worship. And we actually got calls into our health department call center from someone who attended that clinic and did not want to go back to that clinic. They did not, as Taylor was talking about customer service, they did not have a good experience. They want to find a new place for a second dose. And we knew nothing about that clinic being operated. And that resident actually waited for 5 hours with 3 children in tow to get their vaccine. Now, I don't know all the details, but perhaps the clinic wasn't set up to support everything that Taylor shared with you as far as the flow and the physical distancing, because we want them to be safe and positive experiences. We also, you know, we've heard of independent pharmacists approaching houses of worship saying, hey, we can come in, we can do 1,000 doses, let's do this. And that's great. And we don't want to slow down vaccine access, but we also want you all to be fully informed of your capacity to, and the considerations needed to make that decision that reflects positively on on you as a house of worship and the residents who may come to you for this support to access vaccination. So we are not at this time asking you all to host a clinic on behalf of the health department. We are grateful for those of you who have presented yourselves as willing to host clinics, and we're assessing them, and we're trying to match, at least from the health department vaccine equity work, we're trying to match, is this the right location? Is it a large enough facility? You know, is it reaching the right target population? We're asking lots of questions from the health department. Again, if you are independently approached, we don't want to slow that down, but we want you to be informed, which is why we asked Ramona if we could present in front of you today so that you could make informed decisions. If an independent pharmacist should present themselves to you wanting to host a clinic, you understand what's needed for a COVID clinic. And one thing we can do as far as technical assistance is if an independent pharmacist has approached you, you can provide that information to me, or Ramona and I will work it out, but we can research to make sure that independent pharmacist is certified and qualified and has the necessary equipment and processes in place to be essentially a mobile outside of the pharmacy clinic. So if they're going to host a clinic in your house of worship, we want to make sure that they are in fact certified by BDH or CDC to host that clinic. It's not a matter of just saying, hey, give me 1,000 doses and I'll put them in draw them up and put them in folks' arms. The COVID vaccine has all kinds of requirements that providers need to comply with. And from the health department standpoint, we look to make sure they have been approved by BDH, they have the right refrigeration or cooler data loggers to make sure they keep the vaccine at a viable temperature consistently. I mean, we can provide that technical assistance to say, yes, this pharmacist is approved to deliver vaccine in a mobile environment. That we can do, but as far as doing site visits of all the many houses of worship, that is difficult for us, which is why Taylor is providing this guidance to you so that you can be informed.
All right.
I
Thank you.
probably went too far on that answer, but.
No, that's good because it answered one of the questions that was in the chat about how can people verify if an independent pharmacy comes and asks them. So I think that was great. So I'm gonna skip a few of the questions because they were about using volunteers, and I think some of that is in the handout, but then also you clarified that this is also for the houses of worship to be prepared themselves in case they are approached by independent pharmacists. If they are approached by the health department, giving those geographic locations and goodness of fit, then Taylor would come out and do a visit, and there would be this whole process done to assess and talk about volunteers and what's needed. So they would definitely have that type of one-on-one technical assistance at that time. But there's a question about maybe some barriers that people face that I think would be good just for discussion. So there's some concern about our immigrant population or asylum seekers, papers that are needed. What are people asking for just overall when they're coming for a vaccine, or what do they have to present with at a vaccine clinic? And maybe that could also feed into maybe what some questions a provider may be asking of a house of worship, that people have to bring documents, things of that nature. If you could talk about that a little bit.
Sure. So we do not, from a county standpoint, we do not ask for ID. Some providers, the pharmacy providers, may ask for ID in order to verify birth date. So it is important to verify age, birth date. So that's when they ask for ID. That's what that is about. Sometimes they may ask for insurance information because these independent pharmacists and other providers, hospital providers like Inova, they can bill insurance to cover that administrative fee of delivering the vaccine. So there's, even though the vaccine is free and there's no cost, there is still a need to recoup the expenses of, staff administering the vaccine. So they might ask for insurance information, although all of the registration forms should have the opportunity for someone to indicate they do not have insurance. And when someone does not have insurance, the vaccinator can submit a claim to the federal government for that fee. So insurance is not a barrier, but it may be asked because in order to submit to the federal government, they have to ask and verify first that the person is truly uninsured. So that kind of paperwork, insurance cards may be asked for, but again, it is never a barrier. They can always receive vaccine. And there is no out-of-pocket cost. Whether or not someone has vaccine, there is no out-of-pocket cost. If a provider is coming into your house of worship and wants to offer a clinic where folks have to pay $40 or something, and sometimes we do that with seasonal flu. Like sometimes we might host a seasonal flu clinic and it might be $30 or $40 just, to pay for the cost of the vaccine. If there is any kind of cash up front type of arrangement, that is not advised because there is no out-of-pocket cost for the COVID-19 vaccine. So be very careful of that if that is presented. And there's no, anyone who is resident in our community can receive vaccine. Immigrants, asylum seekers, anyone. And again, the only time ID may be asked is to verify birth date or address. But we can, and if there is someone who truly has nothing, our health department clinics and these vaccine equity clinics are really exactly the place where we are trying to support folks to register vaccine using our trusted partners such as yourselves or other nonprofit partners and other partners in the community to connect people. So Insurance is not a barrier. ID is not a barrier, although it is used to verify birth date or address or something, but it is not a barrier.
Okay, thank you. And if they are approached by an independent pharmacist, should they schedule for 2 days? Should that be part of their scheduling? If they're doing a 2-dose vaccine, should they schedule for those 2 days and confirm that? And how do they make sure that that's going to happen? I couldn't think of a better word, but to make sure that the pharmacist has the capacity to not only come for the first dose, but also return for the second dose in the timely fashion, which is needed for the vaccines.
Yeah, that's a great question. So as you all know, we're on pause right now with Johnson & Johnson, which is 1 dose. So if Johnson & Johnson it comes back online, we can do 1-day clinics. But if someone is offering Pfizer or Moderna, you do need to make sure that your facility is and your house of worship is available for the return appointment. So Pfizer is 21 days and Moderna is 28 days. So if someone wants to come in, just make sure your facility is also available on the day 21 or 28 days out. If they come in on a Saturday, make sure they can come back 3 weeks later or 4 weeks later on a Saturday. That's really important, and it really helps the resident who is receiving vaccine from you, because our mantra really has been that you return to where you received your first vaccine for your second dose. And so in your planning, you do need to make sure the banquet hall or the fellowship hall or what have you is open on that date in the future as well. But they are a pair. They need to be available and they go together.
Okay. And I'm just clarifying, so people who don't have ID will not be turned away. Is that correct?
People that do not have ID will not be turned away, certainly from our vaccine equity clinics. I did ask one of our providers who was doing a clinic, supposed to do a clinic this upcoming Sunday, which was canceled because of J&J, that they were asking for ID, and they told me the only reason why they asked for ID is to verify date of birth.
Okay. Okay. And Susan is asking, is there a state registry with names, date, type of vaccine for everyone who does get immunized? Does each client get a card with that information? And I guess, is that with all of our, with independent pharmacies, will they also have those cards as well that the health department issues?
Yeah, that's another great question. So there is a state registry with names, date, type of vaccine for everyone who gets immunized, and that's the Virginia Immunization Information System. We call it VIS, V-I-I-S. And VIS is, we may think of when we bring our children to the pediatrician and our babies and our young children, and they get all of their vaccines, and all vaccines are uploaded into VIS. And even as adults, if we've received seasonal flu shot or shingles or COVID-19 vaccine, it is uploaded into VIS. And that is actually one of the requirements for someone to be a vaccinator. Remember, I told you we can verify that they are in fact eligible to be vaccinators. The CDC and VDH, Virginia Department of Health, have requirements to be a vaccinator. One of those requirements is that they have an account and access to VIS, and they must input that vaccine provided within 24 hours into VIS. That is a federal requirement. So we were aware of a clinic when a resident called our call center and wanted to find an alternate place for a second dose. We looked in VIS and we couldn't find that client in VIS. So that is actually a failing of compliance requirements by that vaccinator to not enter into VIS. So again, it's not just giving doses and giving giving shots. It is actually other requirements such as access an account within VIS and the expectation and the requirement they enter that vaccine within 24 hours of distributing it into VIS. And And when it is in viz, if an individual goes to their, if they get vaccine in the community and they go to their private provider has access and will know that they received COVID vaccine on a particular date. So that's already in viz, it's an electronic system. And then for the cards, those come with the vaccine. So if we hand out or redistribute 100 doses, we also distribute 100 of the cards. And that's all part of the cache of supplies that accompanies vaccine.
Okay. All right, so there are a couple of different questions here. So there are three. So one is about the map that you showed with some of the disparities that we're seeing in the county as far as those who've been vaccinated, and the racial disparity for Route 1 area, and wanted to know like what the health department was doing to decrease that disparity and how you're working with neighborhood groups and specifically the Route 1 area. There's one question. Yeah, then the other two are combined. So I'll let you answer that one, Sharon. If you want to share some of the
Sure.
engagement that's going on there.
Sure. So we are actually preparing a report to the Board of Supervisors, and it's due on Friday, about our vaccine equity strategy. So once that is shared, it will be publicly available to view. But what we are doing is establishing clinics and supporting clinics in these areas of disparity. And we are working with numerous trusted partners to fill, this week we had like 5,000 appointments or 5,000 doses. So we're working with trusted partners to reach out and help us register vulnerable residents in those areas of disparity. So when we say neighborhood groups, if that neighborhood group is considered a trusted partner, can help us outreach, we are working there. We are setting up clinics. For example, this Sunday, we will have a clinic within the Audubon community, on site, deep in the community. We are setting up clinics in houses of worship, like we have one operating at Bethlehem Baptist, who was a trusted place, trusted sanctuary for folks in the community to receive vaccine. So our strategy is place-based, and it is critical that we have our trusted partners that help us to connect residents to help us reduce that disparity.
And are you able to share information about the homebound program that you mentioned? Or if there are people who need to be connected to that, I'm looking for the exact question, but what is the information found? Where can information be found about the homebound program if there are community members who may need access to that service for vaccination?
So we have shared the homebound program with the adult and aging, with the Disability Services Board and the different boards, authority, commissions, I'm blanking right now, that support older adults and individuals with disabilities, Long-Term Care Coordinating Council. We've been sharing the availability of the homebound program with all of those advocates and all those groups. And really the best means, if someone is in need of support for a vaccine, they need to call our health department call center, and I'll put that number in the chat, but it's 703-324-7404. And so when folks need support with vaccine, that's really where they should go. And that's where the request will be elevated to the call center supervisor, who is a nurse who can assess if that person is eligible for a homebound vaccine. So any vaccine support that is needed or questions, they should call the call center.
Okay. And then someone asked if we would ever be able to do a clinic without registration. So I guess that's more like, will we ever have like a walk-up clinic where people would be able to just come without being registered for the vaccine?
So we haven't, up until this point, we haven't, because it's been, as we've been rolling out in phases and eligibility, we do pre-registration. Taylor addressed, flow and the queue and make sure we're pacing ourselves. So that is why it has been important to pre-register folks. Although that being said, we are going, like, for example, we're going to be in the Audubon community on Sunday. We are pre-registering in advance because we do need to ask questions of, someone's prior experience with vaccine, if they have any allergies and all that kind of stuff. And we'll probably pre-register most appointments. That's our goal. We will, if we have capacity, we will support walk-up vaccination in the community. But right now, because we have to make sure there's a dose allotted for someone, we have not done any walk-up appointments anywhere. And part of that's the eligibility, and part of that is just making sure we have the supply and the dose and the pace of folks coming in the door at an appropriate level. So we're going to try some walk-up, although the person will still have to be registered and all that once they arrive.
And I'm going to clarify that question because I misunderstood. So they meant not just registering through the county, and I think you have talked a little bit about the equity clinics and registering through our trusted partners. Maybe you want to just share that again about how other ways that people can register if not coming through the main county queue.
Right. So starting Sunday, folks will use vaccinefinder.org. That was, I'll put it in the chat. And when you go to vaccinefinder.org, you'll put in your zip code and you'll be provided within whatever that distance is, 25 miles, you'll be provided all of the options for vaccine, where to receive vaccine. So that is where hopefully most of our residents will go to find vaccine. And then these vaccine equity clinics that we've been working on, they're not in Vaccine Finder. They are vaccine clinics where we are working with trusted partners to connect people to that. And if you all are interested in being a trusted partner, I would reach out to Ramona, because Ramona has been supporting she's one of many who are helping us to support registration for these vaccine equity clinics.
And I'm putting my email in the chat just in case you don't have it. And then just wanted to follow up with something, and just a question. So on the 18th, every adult in Fairfax County will be eligible to register for using Vaccine Finder. We'll be able to register for vaccine clinics. So as many of our houses of worship, as we all know, that people may worship and live in different jurisdictions or in different cities. What does this mean for their membership? Does this open for everyone? Is it because it's statewide? Will it be that people could come if I live in Loudoun County, but I go to church or I go to a temple in Fairfax? Will I be able to come through my place of worship to get vaccinated if they're going to help us to register people? Has there been any thought about that?
It will actually be nationwide. So anyone that presents themselves who's eligible for vaccine can get vaccine. So it is nationwide. Now, our work with our vaccine equity clinics, we are certainly focusing on Fairfax residents. That's really where our efforts are focused. That being said, if a house of worship has a proportion of folks that might live in Prince William County, if they are the best way to connect to those residents, then we will likely support that. Many of the doses, I'm happy when we have a provider like Safeway that has federal doses, because they're still doses, but I always call them bonus doses for the community. So, but after April 18th, anyone who's eligible for vaccine can receive vaccine across the country.
Okay, wonderful. I'm sure that's good news for a lot of people. So thank you for sharing that with us. And one final question, Irene is asking if there will be wording that will go out that they can use to put in their newsletter about April 18th. So I'm not sure if, sometimes I send stuff that I get from the health department, more often, not sometimes, that I send stuff from the health department, the language out, I'll blast it out, Irene, and then you could use that if that works for you.
Yes, and we will have a blog post go out in the next few days. You'll see the blog post with the directions and the message for the community. And then Ramona a lot of times repackages that and sends that out to you guys.
The good cut and paste. Yes, I get it directly from the source. Sharon, could you could you tell us how our supply is at this point? And then also, can you share the age? Is it 16 to adult or is it 18 to adult?
So the supply is fine, although the pause with Johnson & Johnson did put a crimp in things, so we had to redistribute where we could. But we're, with the federal doses and health department doses, we are distributing them as quickly as we can. Of course, we'd love to have more supply, but the pause on Johnson & Johnson did create a bit of a disruption, to be honest. And then, what was the other question, Ramona?
The age.
Oh, so Johnson & Johnson and Moderna are only ages 18 and above. Pfizer can be given to ages 16 and above. Okay. So Pfizer is the only vaccine that is approved for emergency use for ages 16 to 18, and they have submitted paperwork to FDA to be considered for emergency use authorization for 12 to 16, but I don't know the date when we might expect to see that, but there is movement to see if it can get emergency use authorization for ages 12 to 16.
Okay. And this really is the final question, Sharon, because it's 2:29. Can you just clarify, will Fairfax County residents still be registering through Fairfax County, or is that being phased out? What is that process going to look like?
Right. So again, that will be in the blog post coming out, but vaccinefinder.org will be the place for people to find vaccine once it is open to the whole community.
Okay. Thank you so very much, Sharon, for your time. Thank you, Taylor, for both of you all for being with us and providing such comprehensive information. The PowerPoint will be available. We'll get that out to everyone, as well as we will also have this Zoom meeting available for you all to view as well. And then we're just going to have Fatima close us out. Thank you all.
All right, thank you. Let us pray to the Lord of the worlds, the Lord of all people. Dear Lord, bless us as we navigate these challenges we face as humanity. Allow us to lift up one another during this time, to care for ourselves, to care for others, and to be in service of you. Bring us healing and comfort as we deal with this pandemic. Bless all of those who are involved in the front lines combating this virus, including health professionals, public servants, and volunteers. Provide comfort and light to those who are dealing with a loss, health issues, financial difficulties. Grant us the strength and the fortitude to bring social justice and equity for all in our community. Accept our prayer, dear Lord. Amen.
Thank you so much, and have a wonderful day, everyone, and continue to be safe. And please look for the information that I'll be emailing out. Take care.
Thank you. Bye.